Hi Nurslings, in this video we're going to talk about the Basal Infusion Pump for Diabetes Type 1. This is a really nifty little machine. I think it's changed some people's lives dramatically. It definitely comes up on tests and absolutely will come up when you're prepping for NCLEX. So let's get to it. The Basal infusion pump, this is amazing. I have a friend who actually has one of these and it just changed her life. It's a battery operated kind of little pack. It's about the size of a pager. I mean, they used to be a lot bigger. And you have this kind of little sub-Q sticker that with the little sub-Q needle that's kind of on you all the time. You do have to like clean it, whatever, but it's attached through this cannula into this little battery operated pack, and inside of this pack is this big thing of like a reservoir kind of insulin, and it mimics that basal rate, kind of lets it go through all day, and then you program it based on kind of your typical blood sugars. You would program it to release that kind of more bolus throughout the day. Have to be really careful with these pumps that you're eating regularly, and you kind of keep a very like a similar pattern of eating every day. Obviously, there are issues with it's battery operated, so you want to make sure it doesn't run out of batteries. Patients have to learn how to program it, so it can be a little bit difficult with that. What's really important with these, and this is the question that comes up in NCLEX prep a lot, you still have to monitor your glucose regularly. You can't just, depend on that. You could go into hypoglycemic shock very quickly if you're not paying attention. And again, you need to change the tubing every couple of days.